Welcome back to Medicare Tales and Marshmallows, the podcast that brings clarity, comfort, and just a hint of campfire chaos to your healthcare journey. Today, we're delving into the depths of the plan that's either the best thing since sliced bread or a loaf with surprise raisins, Medicare Advantage, aka Part C. Is it the hero, the villain, or that morally gray TV character you kind of root for even when they commit light fraud? Here to help us sort through the plot twists is the brilliant Dr. Connie Aldridge. Connie, welcome back to the fire.
Always a pleasure, Kem. I brought tea, my Medicare Advantage decoder ring, and 3 dramatic stories from my inbox.
Right on. So let's get right into it. What is Medicare Advantage?
Medicare Advantage, also called Part C, is a way to get your Medicare coverage through a private insurance plan. It combines Parts A and B, often includes Part D, and tosses in extras like dental, vision, and gym memberships. It's like ordering the combo meal instead of a la carte.
And you're still in Medicare.
Yes and no. You're still in Medicare, but the federal government pays the private plan to manage your care. Medicare itself is no longer your primary payer. The plan is, but they must cover everything Medicare covers.
So instead of Uncle Sam, you get Cousins Blue Cross Blue Shield, Humana, Aetna, United Health, Cigna, Devoted Health, Wellstar.
Exactly, and many more cousins. Basically, any private insurer who offers Medicare Advantage plans in your area. And sometimes they want pre-authorization before you see a provider.
Ah, yes. Before we get to the dreaded pre-auth, let's talk pros. What do people love about Medicare Advantage?
Oh, there's plenty to love. Low or zero premiums, though you still pay your Part B premium. All-in-one convenience, medical, hospital, and drug coverage in one place, or like I say, one card to rule them all. Extra benefits original Medicare doesn't cover, like dental, vision, hearing aids, over-the-counter allowances, and even transportation to medical appointments. Annual out-of-pocket maximums, which original Medicare doesn't offer.
And the cons, I feel a dramatic reading coming.
Okay, cue the ominous music. There are no free lunches. Network restrictions. You may be limited to certain doctors or hospitals. Prior authorization. Yes, we know your doctor wants the MRI, but we need to approve it first. Maybe. Changing benefits. Plans can change year to year, and you must review them annually. Must stay local. Some plans don't travel well, especially if you snowbird or want to roam the country in an RV.
On that note, people often get confused between Medigap and Medicare Advantage. What's your favorite way to explain the difference?
I tell folks, Medigap or Medicare Supplement closes cost-sharing gaps with no additional benefits. You keep original Medicare, pay more upfront and premiums, but have predictable costs and freedom to see any Medicare provider. Medicare Advantage closes coverage and benefits gaps in original Medicare, but does not address cost-sharing gaps. This option replaces original Medicare with lower premiums, potentially higher cost-sharing, more bells and whistles, but make no mistake, with Medicare Advantage, you're in a managed care system where the insurer gets a say on the doctors you see and services you have.
So Medigap is a reliable sedan with a monthly car payment and fully paid-up service plan that covers maintenance and repairs, but you make the car payments whether you drive it or not. Advantage is a fully paid-up shiny SUV with no additional car payments, but you pay a percentage of ongoing maintenance and repairs.
I don't know much about cars, more of a cyclist myself, but that sounds like a pretty apt analogy. Well done. And sometimes the SUV comes with free yoga to help manage your road rage, but you still need to pay your tolls on the highway.
Yoga does help, or so I'm told. Okay, you promised the listeners some stories.
Well, let's see. There was a gentleman in Iowa who loved his Advantage plan, said it gave him dental, hearing aids, and the power to cancel his gym membership because now it was free. But then his cardiologist left the network and he had to drive 90 miles. Still said it was worth it for the dentures and SilverSneakers. Called it a trade-off with perks and plot twists.
That's real funny. A real Medicare Advantage vibe. Trade-offs with perks and plot twists.
Absolutely. It's not good or bad. It's fit for purpose, depending on your health, your budget, and your risk tolerance.
So let's hit this home. If someone's choosing between Medigap and Medicare Advantage, what questions should they ask themselves?
Great question. Do I want flexibility to see any provider that takes Medicare? Am I okay with networks and referrals? How's my health? And am I willing to trade low premiums for higher cost sharing later? Do I travel a lot or live in multiple states? Do I value extras like dental and vision or prefer financial predictability?
So know thyself and thy preferences pharmacy.
And thy zip code. Medicare Advantage is incredibly regional. What's great in one county might be a disaster next door.
Dr. Connie, you are a gift wrapped in Medicare regulations and a warm shawl of snark. Well, there you have it, folks. Medicare Advantage. Is it a hero, a villain, or just a misunderstood protagonist? Only you can decide. For now, that's a wrap on our Medicare Advantage adventure. Until next time, stay warm and marshmallowy.